Diabetes Par Charcha, a special program on fasting in Ramadan. Religious fasting is common, but it can be dangerous for diabetics. Over 50 million Muslims with diabetes worldwide are fasting during Ramadan. Let's see what our panel of experts have to say on this.
Today we have an elite panel of endocrinologists from Mumbai who will shed more light on this issue. We welcome all of them.
The main thing that you need to keep in mind is that their eating pattern changes. So whatever we keep prescribing during the day, we have to sort of put that in the evening or at the night, because we are worried about hypoglycemia during the daytime and hyperglycemia during the night time, क्योंकि उनके खाने की आदतें बदल जाती है उस महीने के लिए. So both these factors are very important. How to see that the evening and night meals are such that they don't cause too much of a rise in sugar, and what is more important is during the day when they are fasting, they should not go into hypoglycemia.
So when a patient has low sugar, especially which we are expecting in the long fasting hours, the patient can have sweating, they can have palpitation, they can have tremors, they can have tingling in their hands and feet. And sometimes we've also seen situations, a lot of our patients tend to rest in the daytime hours. So sometimes these patients are resting and the rest is for a longer time, and the family suddenly realizes that actually the patient is having a low sugar. The most important message that we want to give our patients through this medium is that if they have any kind of low sugar, one, they have to check the sugars compulsorily, which is absolutely mandatory. Two, that they need to break their fast however close they are to iftari. Iftari is the time that you break your fast, but we need to understand that in a situation of Ramadan also you are allowed to break fast. Fasting does not mean that we are trying to torture the human.
So if just skip the insulin, we are worried in those patients. Elderly patients who may have low sugars, that's one group which are very vulnerable. Other group which may be vulnerable is patients who have liver issues, patients who have kidney failure. Similarly, any patients who have repeatedly, been having the issues of low sugars, we tell them, that you are more prone, and if possible, you should think of, not keeping the fast. So these are the groups which are, vulnerable.
I think it's a good idea if you emphasize what he said, the last part. If you have a morbidity, if you have an underlying complication that you already know about, then the ideal thing would be not to keep the fast. और अगर रखना ही बहुत ज़रूरी है, then instead of the 28 day, go for a smaller number so that you don't strain your body too much.
I think the question that you've asked is a very vast. Your question is what should be done prior to Ramzan and what can be done to tackle the complication. First of all, this is called as pre-Ramzan counseling, and I would like to tell our viewers that ये चीज़ जो काउंसलिंग होती है रमज़ान के पहले, ये सिर्फ उन लोगों के लिए नहीं है जिनको सिर्फ रोज़ा रखना है. ये काउंसलिंग उन लोगों के लिए भी है जिनको डायबिटीज़ है और रोज़ा किसी कारणवश नहीं रख सकते हैं. जैसे अभी डॉक्टर डेविड चंद जी ने बताया कि कुछ ऐसे ग्रुप ऑफ पेशेंट्स हैं जहाँ पे रोज़ा नहीं रखा जा सकता, लेकिन जब सहरी और इफ्तार का वक्त होता है तो वो लोग भी सामने रहते हैं, दे ऑल्सो ईट विद देम. So at first message is that counseling for all diabetic patients during Ramzan.
Guideline which is there for fasting and diabetic patients specifically for the Ramadan.
First of all, let me congratulate the team of for channelizing this really practical and informative discussion. Your question is very valid because other than looking at an available resource like a doctor, most of the patients now want to go a level up and looking at something called as an e-resource, something that is available on internet. What is our responsibility is to channelize them to a right kind of e-resource. So these e-resources become consensus statements, guidelines, or statements released by specific bodies, and there have been statements released time and again which are country specific, as well as some bodies have released their own statements which have came in reputed journals. But if you want to refer to one kind of a right resource, this is applicable both for the patients as well as doctors, something that can be handy to you, and if you want the right kind of label which you can put in the Google and get a right information, those are guidelines released by International Diabetes Federation in 2017, which have been endorsed and accepted across the world. So if you want to go to the right resource, it is the International Diabetes Federation or IDF.
The most important part of diabetes management is the medication which the patients take. and during Ramadan, I think it becomes even more important. So, what are the changes the patients can do, should do actually, and before Ramadan, during Ramadan, and after Ramadan?
So I think we've already discussed that these people are more prone to hypoglycemia during the fast and hyperglycemia during the iftar time, post breaking the fast. So you need to be a little careful. Obviously, most of these patients should undergo a pre-Ramadan counseling so as to review what are the complications present at that point of time before fasting, and subsequently how do they adjust the medications. Since they are prone to hypoglycemia, one should be very careful of what drugs they are going to take. So there are some people who are on oral drugs and some who are on injectables, whether it's insulin or GLP-1. Obviously, we need to know that these people are going to have meals after in the evening and throughout the night. So their medications need to be changed.
Important message which everybody is trying to give is please see your doctor before you fast. See your doctor, allow them to readjust medication so that you have a fast. The main contention of this entire group is that our patients fast safely. There's an absolutely problem for Ramadan for them and for us also.
बट उनको लगता है कि अगर वो डायबिटीज रोजे के वक्त डायबिटीज है और अगर चेक करेंगे वो खून बाहर निकलने से रोजा टूट जाएगा, तो उनको वो फियर इज तो से थोड़ा बाहर लाना है. रोजे की हालत में ब्लड टेस्ट को चेक कर सकते हैं और चेक करने की वजह से रोजा नहीं टूटता है. स्पेशली अगर पेशेंट मॉडरेट या हाई रिस्क में है या सिम्टम्स आ रहे हैं हाइपोग्लाइसीमिया के, तो उस वक्त चेक करना ज़रूरी है. स्पेशली असर के वक्त, मतलब इफ्तार के 2 घंटे पहले अगर थकान लग रही है, एकदम से कमज़ोरी लग रहा है, कुछ समझ में नहीं आ रहा है, जो कि काफ़ी पेशेंट्स में होता है. सडनली हमको कॉल्स आते हैं शाम के टाइम पे, डॉक्टर चक्कर आ रही है और रोज़ा है, क्या करना है. तो उस वक्त हम बोलते हैं कि आप चेक करिए और चेक करके देखिए किस तरीके से आपका शुगर वैल्यूज़ कितना आ रहा है, और आप ग्लूकॉन डी पाउडर से उसको ट्रीट भी कर सकते हैं उस वक्त. तो टेस्ट करने से रोज़ा नहीं टूटता है. ये एक बहुत इंपॉर्टेंट मैसेज है जो हम देना चाह रहे हैं इस टीवी शो से.
I've seen enough of my patients who had a very comfortable Ramadan in the past on the same dose that they were taking earlier, switch the morning dose to night and the evening dose to morning. And that's it.
So we often also see patients who if they've done well the previous Ramadan, they don't follow up this Ramadan. And they say, I did exactly what you told me to do last Ramadan, not realizing that in that 1 year there could be changes. I'm sure all of us see this situation, So I really want to request everybody that it's 365 days of the year. So what you have done last Ramadan may not be applicable this Ramadan. So it doesn't hurt at all to check yourself, to get your levels checked, to understand what is going to suit you better this Ramadan, other than saying I had a safe Ramadan last year and I did absolutely well, ma'am. So this Ramadan, I have lots of patients who come to me actually after Ramadan. So, ma'am, I did perfectly well. Thanks, whatever. But I think that's a wrong concept. There's a lot of glycemic variability during Ramadan. When I'm talking about glycemic variability, आपकी शुगर बहुत नीचे जाती है, फिर बहुत ऊपर जाती है. इफ्तार के बाद आपकी शुगर बहुत हाई जाती है. And during सहरी, मतलब आप सहरी के बाद दिन भर में बहुत लो रहती है. I'm sure everybody has their own anecdotes to add over here, sir.
As a group, everyone is going for सहरी to get iftari. They may skip their insulin doses. तो वो बहुत ज़रूरी है कि you're with your friends, you're with your relatives, but please don't skip your insulin dose. नहीं तो अगर आप skip करोगे insulin dose, type 1 के बच्चे especially, उनमें फिर बॉडी के कीटोन्स बढ़ेंगे, डायबिटिक कीटोएसिडोसिस में जा सकते हैं.
ये नहीं करना आपको, वो नहीं करना, आप रोजा नहीं रख सकते, ब्लू. My patient comes back and says, मैं तो रोजा रख लिया. Then I realized this. और अच्छे से हो गया literally.
That is where I think I agree with David and Madam कि अच्छे से हो गया. क्या मतलब, अगर आप टेस्ट नहीं कर रहे हो और इंसुलिन नहीं ले रहे हो और टाइप 1 है, तो आप रोजा कंप्लीटली नहीं रखें, क्योंकि हाई और लो इतना बढ़ जाएगा, वो वेरिएबिलिटी इतना स्विंग होगा कि आपको चक्कर खाकर हाई शुगर से जो डायबिटिक कोमा बोलते हैं, वो टाइप 1 के इंसिडेंसेस रमजान में बहुत बढ़ जाते हैं. इसके अलावा 80% लोग जो रोज़ा रखते हैं जिनको डायबिटीज़ है, वो 15 से 21 दिन तक रोज़ा एकदम हेल्पफुली और अच्छे से हेल्थफुली रख पाते हैं. लेकिन 21 से 27 तारीख के जो रोज़े होते हैं उनमें शुगर फिर से ड्रॉप होना शुरू होता है.
The entire day you're without any fuel in the body. तो वापस हाइपोग्लाइसीमिया होने का रिस्क है. एंड थर्ड थिंग इज डिहाइड्रेशन. अगर आप पानी नहीं पियोगे ये रात के जो टाइम में, तो देन बॉडी में पानी का मात्रा कम होगा. Again, there will be complication because of that.
Secondly, often ऐसा होगा अगर पेशेंट नहीं भी रोजा रख रहा है तो पेशेंट खाएगा नहीं. I mean, we face these situations, I'm sure everybody knows it, that, we face the situation जहाँ patient खाएगा नहीं, बोलेगा नहीं, मैडम मैं कैसा खाऊं. So these are also social occasions. So as doctors, we need to be emphatic with that also. वो समोसा को आधा करके खा लो और बाकी veggies और fruit खाओ. Something like that becomes a more moderate. I think moderation is very important rather than going totally, because Ramadan, I think, without the fried savories is just, sort of unheard of. Though nowadays it is helping us with these.
And so we tell our patients simple tips like the first part what you have should be salads or fruits, and then you have something that is protein rich, and then you go to the carb rich part like sometimes sweets or that samosa and all that came. So a simple good pattern and a simple message that the quantity of good food has to be more than the quantity of bad food, and the good food has to precede the bad food. Most of the things can be solved in these two simple taglines.
एक बहुत frequent question आता है, क्या हम खजूर खा सकते हैं? Yes, आप खा सकते हैं. Second is because दिन भर का fasting होता है, रोज़ा होता है, spirituality zones high रहते हैं, तो fruits का लेना बहुत important होता है. And I think this is the time जब एक balanced एक fruit plate बहुत important है लेना. आप कोई भी टाइप का मीठा फ्रूट ना लेकर अपने डाइटिशियन से और अपने डॉक्टर से डिस्कस करिए कौन सा फ्रूट आपके लिए, डिपेंडिंग ऑन आपका किडनी का लेवल्स कैसे है, क्रिएटिनिन कैसे है. इसके अलावा हर घर में बहुत सारी चीज़ें होती है. इन्होंने कहा, जैसे मैंने बताया कि प्रैक्टिकल होना चाहिए, तो हमने देखा है कि डायबिटीज़ पेशेंट खजूर और फ्रूट के अलावा वड़ा, समोसा, कचौरी, पकौड़ा, पूरी, पराठा, पास्ता, पिज़्ज़ा, क्रिस्पीज, हर एक चीज़ वो प्लेट में लेते हैं. बट एक प्रैक्टिकल टिप हियर इज के फ्रूट और शरबत जो दूध का, उसके अलावा आप एक कोई भी फ्राइड आइटम लो जहां पर आप अपने पोते के सामने भी खा सकते हैं, समधन के सामने भी खा सकते हैं. आप कुछ खाकर जाइए या आप फ्रूट अच्छे से, शरबत अच्छे से लेके मगरिब की नमाज पढ़ लो, आप तरावी पढ़ लो और उसके बाद हल्का खाइए. ऐसे काफ़ी सारे पेशेंट्स हैं मेरे और मैडम के भी, जो लोग दिन में 2 बार खाते हैं और इतना खा लेते हैं कि फिर ट्रक लोड हो जाता है और सो जाते हैं सुबह में, सहरी के बाद में भी और इफ्तार के बाद में भी, और वो उठते ही नहीं है बीच में. और ऐसे पेशेंट्स भी हैं. बट इस्लाम सेज वेरी क्लियरली कि आपको रमज़ान में काम पहले से ज़्यादा करना है, रमज़ान में आपको इबादत या प्रेयर्स पहले से ज़्यादा करना है, इसीलिए तरावी है.
Any point of time in the day, if you feel that your sugars are going low, immediately check your sugars and immediately break your fast. This is the most important. Because if you...
इसीलिए इम्पॉर्टेंट इज टू अंडरस्टैंड कि हमको किस टाइप का खाना लेना है और क्या है. इट कैन बी अ शैलो फ्राई, इट कैन बी अ समोसा इन ओवन, इट कैन बी अ बेक्ड समोसा, इट कैन बी अ काइंड ऑफ अ मोमो विच कैन बी देयर. तो ये चीज़ें जो कंटेंट सेम है, कैलोरी अगर हमने चेंज किया तो बहुत ही वहाँ पर हेल्पफुल रहता है.
So what do you...
कि सहरी और इफ्तार में क्या खाना है, तो पढ़ने के बाद भी ये क्वेश्चन आ जाता है, ये लिखा हुआ है, अच्छा डॉक्टर फिर ये सब खाने के बाद क्या खाना है. सो वी कैनॉट रियली गिव अ ब्लैंक चिट्ठा कि भाई यही खाना है और इसी को फॉलो करना है. इट इज इंडिविजुअलाइजेशन, जो मैंने आपको शुरू में
Can I continue my exercise during fasting in Ramadan?
So, one should definitely, in Ramzan, the main fear is hypoglycemia and obviously hyperglycemia. But remember, hyperglycemia is for a month duration. Hypo is more what that we are worried of, much more.
Yeah.
So with exercise, obviously your glucose levels are going to come down. So I would not advise one to do rigorous exercise. Definitely not. A light or moderate exercise, I would say, can be done. But if you want to do it, probably it's after iftar. And in fact, as earlier pointed out also, one of the prayers itself is an exercise, a good kind of an exercise, which actually helps you in reducing your levels. So one can do, but it's evening post iftar, but not rigorous exercise.
A different category of patients. Can pregnant women with GDM fast, and can pregnant women who are not GDM fast? If yes, then what are the precautions which they have to follow?
Okay, so that's a very interesting question. There are two things to this. One is a lady who's pregnant, can she fast non-diabetic? And a lady who's got diabetes, can she fast? So I think here the question comes is somewhere I think we should have taken it in the first, that is there something like that, this is an obligatory thing, or is it if you don't fast you will not be a Muslim, or is there anything like exemption? क्या कुछ लोगों को कहा गया है कि रोज़ा आप नहीं रखे तो चलेगा? So I think
do you give any advice to your patients regarding post Ramadan assessment?
Absolutely. There is a transition from pre-Ramadan to Ramadan where you are making all the changes. Now, during Ramadan, which is a time of fasting, lot of changes happen, and I must say that a good number of my
Pre-Ramadan, the next 2-3 days are going to be a little fluctuation of sugars because you again switched back. But after 3-4 days, more or less everybody just stabilizes and settles down. We don't really see too much of permutations and combinations. But yes, in those special situations where both of them are mentioning, we need to be a little more careful. So that window has to be kept open. Otherwise, it's more or less a very, very smooth transition.
Tablets, your dietary patterns and lifestyle which can be changed and will be more helpful during Ramzan. By doing this, your Ramzan fasting will be eventless. There will be less chances of any complication, if at all. And we have seen over the years.
I also had a very poor patient telling, madam, how do I compensate if I don't fast? Because there are lots of compensation also if you don't fast. Even doing a good deed is a compensation. So, it's very simplistic stuff. It is not very complicated. So, we don't need to make it unnecessarily complicated. I don't think we need to make religion complicated. It is simple. If you can do it, safely you can do it, please go ahead. If your HCP says that, no, I don't think it is safe enough for you, I think we need to respect that, okay, this is the way my body system is, and not to fast. The second thing which I also believe is, as a society, we should not make others feel who are not fasting, oh, you are not fasting. It's like lots of raised eyebrows and things like that. I think that is not really the fairest thing to do. Otherwise, I think Ramzan is a great spiritual experience. It's a great social experience. I always feel that it's because people readjust their work timings. Everybody's meeting up in the evening. I love the fact that everybody meets all throughout Ramadan, practically. And of course, the spirituality is great. And I think the blessings are for everybody across the world. This has nothing to do with Muslim. This has nothing to do with Ramzan. I think especially in Mumbai, I think I take N number of my friends to Mohammedan Road practically all Ramadan. So it has nothing to do with, any kind of this religious breakdown. I think we as Mumbaikars have the advantage that we enjoy all our festivals. So happy fasting to everybody. Less of feasting. Enjoy yourself during Ramadan, and at the same time see to it that you're safe.
I think with that, we are actually coming to the end of this program. So I would like to thank my faculty over here, the experts over here.